Good day, people. I am Henby Obligacion, and this is Biopatrol. Today, we'll talk about one of the most important organ system of a human body, and that is the urinary system and its pathology. But before we proceed to pathology, let's take a look and understand the urinary system of a human body. I'll give you a brief discussion with the basic of biology. As we just seen, the process of digestion and absorption releases nutrients into the bloodstream. That excess nutrients, salts, minerals, and water, as well as drugs and toxins, can also enter the bloodstream through the digestive system. Further, the cell in the body release toxic waste products such as ammonia, which is converted to less toxic urea by the liver into the bloodstream. These excess materials and drugs, toxins, and waste build up into the bloodstream can prevent an individual by throwing off critical chemical balances. The blood and extracellular fluid that bathes body cell must be close to neutral pH. Precisely, regulated concentration of various salts, appropriate level of substances, and of course, cellular waste products must not be allowed to reach the toxic level. The burden of maintaining proper chemical balances or homeostasis in the body falls largely in the kidneys. Human kidneys are paired kidney bean-shaped organs, located on the either side of the spinal column and extending slightly above the waist. Each is approximately 13 centimeters long, 8 centimeters wide, and 2.5 centimeters thick. Blood carrying various ways enter kidneys through a renal artery. After it has been filtered, the blood exits through the renal vein. Your urine, which is a mixture of water, dissolved waste, toxins, and some excess nutrients, filtered down to the blood, leaves each kidney through a muscular tube called the ureter. Peristaltic contractions drive urine through the ureter to the bladder, hollow muscular chamber that collects and stores urines. The walls of the bladder contain smooth muscle capable of considerable expansion. Your urine was retained into the bladder by two sphincter muscles located at its base just above the juncture of urethra. When the bladder becomes distended, receptors on the walls trigger reflexive contractions. The sphincter nearest the bladder's internal sphincter is opened during the contraction. However, the lower external sphincter is under voluntary control, so the reflex can be suppressed by the brain unless bladder distension becomes acute. The average adult bladder holds about 500 milliliters or approximately a pint of urine, but the urge to urinize is triggered by considerably small accumulations. Urine completes its journey to the outside through a single narrow tube called the urethra. The kidney contains a solid outer layer, or urine is formed in a hollow called the renal pelvis, which is a branch collecting chamber that funnels urine into the urethra. The outer layer of the kidney is divided into a fan-shaped inner renal medulla and an overlying renal cortex. Microscopic examination of these structures reveals an array of tiny individual filters or nephrons. Over 1 million nephrons are packed into a cortex of each kidney, with many extending into the renal medulla. Blood is conducted to each nephron by an arteriole that branches into the renal artery within a cup-shaped portion of the nephron, the Bowman's capsule. The arteriole branches into a network of approximately 50 microscopic capillaries that form an intertwined mass, the glomerulus. The arteriole leaving the glomerulus is smaller in diameter than the one coming in, creating a pressure within a structure that forces water and many dissolved substances such as urea, glucose, salts, amino acids, and certain vitamins through its extremely permeable capillary walls into a process called filtration. The resulting fluid, called filtrate, is collected in the Bowman's capsule for transport through the tubule. And there you go. I hope you fully understand the structure and physiology of our urinary system. Now, the main topic here is the pathology of this system. There are many renal diseases of the urinary system that require clinical care by a physician or other healthcare professionals. These conditions are: acute nephrotic syndrome is a glomerular syndrome dominated by the acute onset of usually grossly visible hematuria, mild to moderate proteinuria, and hypertension. It is classic presentation of acute post-streptococcal glomerulonephritis. The nephrotic syndrome is characterized by heavy proteinuria, hypoalbuminemia, severe edema, hyperlipidemia, and lipiduria. Asymptomatic hematuria or proteinuria, or a combination of these two, is usually a manifestation of subtle or mild glomerular abnormalities. Acute renal failure is dominated by oliguria or anuria. With recent onset of azotemia, it can result from glomerular interstitial or vascular injury or acute tubular necrosis. Chronic renal failure, characterized by prolonged symptoms and signs of uremia. It is the end result of all chronic renal parenchymal diseases. Renal tubular defects are dominated by polyuria, nocturia, and electrolyte disorders. They are the result of either diseases that directly affect tubular structures or defect in specific tubular functions. The latter can be inherited or acquired. Urinary tract obstruction and renal tumors represent specific anatomic lesions with often varied clinical manifestations. And of course, the UTI and the nephrolithiasis that are the main focus of this report. Urinary tract infection is characterized by bacteriuria and pyuria. The infection may be asymptomatic or asymptomatic, and it may affect the kidney or the bladder only. Nephrolithiasis is manifested by renal colic, hematuria, and recurrent stone formation. What is a urinary tract infection? It is an infection that can occur anywhere along the urinary tract. Urinary tract infections have different names depending on what part of the tract is infected. Most urinary tract infections are caused by bacteria such as E. coli that live in the colon, especially the rectum. Names given to urinary tract infection includes cystitis, which is infection of the bladder, urethritis, which affects the urethra. An infection of kidneys leads to a more serious condition called the pyelonephritis. Adult women are most commonly affected as their urethra is shorter than men and opens nearer to the anus. This means it is easier for bacteria to enter the urinary system and cause an infection. About 40% of women get at least one attack of cystitis in their lifetime. It is more common in sexually active women during pregnancy, after surgery, and menopause. I will show an animation on how UTI is acquired. Please watch this.
Oh my gosh. Emma, I am so glad to see you again. I just did a Facebook update yesterday about my new boyfriend, Spencer Drake Ellington III.
I am so happy for you. Did I tell you that Fernando sent a text to break up with me last month? He is such a loser. He even spelled my name wrong. What a loser.
Fernando was a loser. He wore skinny jeans. He lived with his mother. He couldn't afford a smartphone or a car. He only had a skateboard, and he played video games all day.
How is your new relationship going?
I love the start of new relationships. Everything is great. He even pretends like he is listening. He turns off sports, and everything is wonderful and passionate.
Yes. The beginning of a relationship is wonderful. I can't wait to find my next boyfriend.
Emma, I need your advice.
What is the problem?
It hurts when I pee and sometimes I feel like peeing but nothing comes out. I don't know what is wrong with me, and I am really worried.
Try not to worry. You probably just have a UTI. I had one when I first met Fernando.
What is a UTI?
A UTI stands for a urinary tract infection. It is an infection that happens when some of the germs from your poop hole gets into your vagina.
How does poop hole germs get into the vagina?
There are several ways, but it often happens when you are having sex where everything gets messed up with everything. It is especially common in new, hot relationships.
What do I do now if I think I have a urinary tract infection?
If you are having symptoms, go see your doctor right away. Get some antibiotics and stop the infection before it gets more serious and spreads to your kidneys.
Emma, I am so embarrassed to tell my doctor that I had sex and now I have an infection.
Are you kidding me? A UTI is often referred to as the honeymoon disease. Most women are stuck in dead-end relationships. You are in the honeymoon stage. I am so jealous.
Is there anything that I can do without going to a doctor?
Drinking cranberry juice may help reduce the pain, but to stop the infection before it spreads, you need an antibiotic. Please don't risk your health on a home remedy or what people tell you. Go see a doctor, and if it is not a UTI, a doctor can find out and treat whatever is causing your pain.
What else can it be? Can it be really bad?
I don't know. That is why seeing a doctor right away is so important.
Okay, you are right. My health is too important to wait. I will call now.
Wait. Before you call, does Spencer Drake Ellington III have any single, cute friends?
My good viewers, we know that you want to know if how is urinary tract infection cured. This time we will consult a specialist to know more information, signs, symptoms, and treatments for urinary tract infections. Here is Dr. Robert Matthews. Doctor?
UTI stands for urinary tract infection. It tends to incorporate a number of different entities to include kidney infections, bladder infections, prostate infections. Those can be given other names, but they all have in common typically bacterial infection of the urinary tract. In men, urinary tract infections typically show up as prostatitis. That is, they feel they have to go to the bathroom more often, they're frequently voiding in small amounts, sometimes they have to push to enable their bladder to get the urine past a swollen and therefore enlarged prostate gland. Sometimes there will be blood associated with that, usually not, but sometimes there can be. Prostatitis in men should be treated initially with a month-long course of antibiotic therapy. The month-long course minimizes the risk of recurrence in the next 6 to 12 months. Urinary tract infections in men, the vast majority of the time, are of unknown cause. Urinary tract infection is not a sexually transmitted disease in either men or women. Urinary tract infections in women are far more common than they are in men and have far greater not only prevalence but recurrence rates in women as well. There are a number of things that women can do to avoid urinary tract infections. The 4 things that I always cover with women. Number 1 is after they go to the bathroom, they should wipe from front to back, not back to front, because that brings contaminants, normal bacterial flora from the vagina onto the urethra, which can put them at risk for infection. Second is their underclothes should be cotton through the crotch area. Third, they should empty their bladder shortly after sex, certainly before going to sleep for the night. And some women are set up for urinary tract infections if they take baths, particularly with additives in the water, compared to taking showers. That said, there are some women who just are prone to urinary tract infections. And there are a number of ways to handle those. For an isolated infection or two every year, routine antibiotics when you have symptoms are most appropriate. Some women require suppressive antibiotics for 3 months or more at a time, where they take an antibiotic pill each night before bedtime in order to establish a sterilized bladder that does not have any bacteria, and then they go on from there to have a more normal pattern without recurring infections. A few other things to note about urinary tract infections in women particularly is they can progress to what's called pyelonephritis, or kidney infection, with some speed. Bladder infections tend to present lower tract irritative symptoms, burning with urination, going frequently, small volumes with each urination. Kidney infections are typically distinguished with the hallmark fever, chills, and flank pain. that presents a greater challenge. It's a more serious illness and needs prompter attention than a nuisance type of urinary tract infection affecting only the bladder. Additionally, bladder infection can also show up with hematuria, that is blood in the urine, that can be seen, usually caused by the infection, but sorting out whether it's caused by the infection or some other cause is the job of a urologist.
Thank you, Dr. Matthews. That was clearly understood, right? Next will be the nephrolithiasis. Nephrolithiasis specifically refers to calculi in the kidney, but renal calculi and ureteral calculi are often discussed in conjunction. The majority of renal calculi contain calcium. The pain generated by renal colic is primarily caused by dilation, stretching, and spasm because of the acute ureteral obstruction. A kidney stone, also known as renal calculus, is a solid concretion or crystal aggregation formed in the kidneys from dietary minerals in the urine. Urinary stones are typically classified by their location in the kidney, ureter, or bladder, or by their chemical compositions. Kidney stones are a significant source of morbidity. This animation will discuss on how renal stone is formed and how to remove. Please focus on this video.
Kidney stones are hard stone-like lumps that can form in your urine. They are common and occur twice as often in men as women. Let's look inside the body to see how the kidneys work. The kidneys are two bean-shaped organs located near the middle of your back. They work as a filter, removing waste products and excess fluid from the blood, and returning clean blood to the body. The waste products and excess fluid become urine. It travels through two narrow tubes, called the ureters, to the bladder, and leaves the body through the urethra. If there is an imbalance in the waste chemicals in the urine, crystals can form, which may build up into stone-like lumps. These are known as kidney stones. This can happen for a number of reasons, including not drinking enough water, a diet high in protein, or health conditions such as kidney disease. If kidney stones are small, they usually leave the body when you pass urine. However, larger stones can get stuck in the kidneys or pass down the ureter, causing irritation and blocking the flow of urine. This often results in an infection and intense pain that is felt in your back. Kidney stones can sometimes be treated with fluids and painkillers. However, if infection develops or the urine flow is obstructed, further treatment may be needed. Your doctor will advise the treatment best suited to you. In shockwave therapy, shockwaves of energy are used from outside of the body to break up the stones into small pieces that can be passed out of your body in urine. In percutaneous nephrolithotomy, a small cut is made in your back, and a thin telescopic tube is passed into your kidney. The stone is then either removed or broken into smaller pieces using a laser. A ureteroscopy is used if a kidney stone is stuck in your ureter. A thin telescopic tube is passed through your urethra and bladder and into the ureter. The stone is then either removed or broken into pieces with a laser. If none of these methods are suitable, the stone may need to be removed using traditional surgery. If you've had a kidney stone, there is a risk of getting another one at a later stage. Your doctor will be able to advise you on medicines and changes to your diet that can help prevent further stones.
And that was it, my good viewers. Thank you for staying with me for several minutes. Once again, I am Henby Obligacion and this is Bio Patrol.